Hi there, my name is Nick Mason and I'm Sponsorship Manager for We Yacht Foundation, Sierra Leone. WICF was founded in 2009 by Santigi Bayodumbuya. Santigi was a child soldier during the Sierra Leone Civil War, escaped the war in 1999, get himself to Freetown, complete his education, get a diploma under his belt, and all the while gain several years' experience in the NGO sphere. Santigi was a child soldier during the Sierra Leone Civil War, escaped the war in 1999, get himself to Freetown, complete his education, get a diploma under his belt, and all the while gain several years' experience in the NGO sector in Freetown. He founded WICF in 2009 because he saw a great need in two communities in particular. The first was Crew Bay, an ocean-fronted community of about a kilometre squared with 6,500 people crammed into this space. Besides the overpopulation, the poor sanitation, the lack of education, the under and unemployment, this community floods for 4 to 5 months a year due to the monsoons and the poor drainage system in Freetown. We run a school there and are planning to build a new one which is raised up on stilts in 2015. Unfortunately, this project was delayed due to Ebola, which I'll come on to a bit later. The second community we work in is George Brook, a seemingly beautiful, tranquil community set in the hills behind Freetown, about half an hour's walk from any major transport route. This community suffers from the same range of social problems that Crew Bay might, with the added dimension that its marginalisation compounds the lack of education and the lack of political representation. We work in this community as well, delivering education programs, and are in the process of finishing a school construction project at the moment, thanks to a partnership with Developing World Connections. But I'm not really here to talk about what we do normally, because frankly what we do normally has been uprooted by the Ebola virus, which has been raging through Sierra Leone since May last year. I was in Freetown on the 23rd of May 2014 when the virus, Ebola, first hit the country. It came in through Liberia, and we were in Freetown, and everyone was saying that this would be something that the authorities are able to stop and to contain, and that it will never reach Freetown and it will never affect the whole country. How very wrong we were. As of today, which is the 23rd of January, there have been 7,935 reported cases, and of this number, 2,974 people have lost their lives. Now that's roughly 11 lives per day since that first day, the 23rd of May. But besides the immediate impact of deaths and families that are torn apart, the cost of living has risen by up to 25% in certain places. For families like ours, in the communities like ours, like Crew Bay and George Brook, this represents an enormous upheaval of their very fragile existence. To the extent that you find that lots of families make a choice between food, clothing, health, a roof over their heads. One of these fundamentals has to fall by the wayside. We do our best, along with lots of other NGOs, and I'll come on to the network of trusted community-based organisations that we're working with a bit later, to support these families as they go through this. But the resourcing is, as you can imagine, a terrible problem, and we can't help everyone. So it has affected people's day-to-day lives in a way that we never could have imagined. It's gone right to the core of people's communities, to the way that they behave as families. Traditional culture has been uprooted. We all understand the effects that's happened to the burial rites in particular, which are all but, if not illegal, then totally, socially unacceptable now that they're associated with the spread of Ebola. And this reflects in day-to-day life in things like people not wanting to shake hands anymore in the street, which has a sincere effect on the way that commerce is conducted and the way that people interact with their neighbours and their community more generally. It has hit right to the heart of people in Sierra Leone. And although people like Santigi, who has been fighting against this virus for the last 6 months in different communities around Freetown, he knows how to protect himself so you can have relative safety. But the fear is there nonetheless all the time. People's sentiment towards government and major NGOs has also been tested. We don't yet know whether this is for the positive or for the negative, but what we know is there's been a lot of conversation around whether or not the programs, the Ebola education, containment, sensitization, isolation programs have been well implemented and successful, and whether there are other methods that might have been more appropriate. But the point is that people have been engaging in a discussion about the effectiveness of different practices for in the response to the crisis, which is a really healthy thing, and it's allowed us as a small community-based organisation to perhaps rethink that and come up with our own approach. But before I go into that, I just wanted to mention one last fact which has shocked me, which is that of the $310 million promised to Sierra Leone in the fight against Ebola, only $110 million has been paid out. That means there's $200 million sitting in the accounts of trust. I should say that's trusts and foundations alone. That means there's $200 million sitting in the accounts of trusts and foundations that have promised to pay a certain amount out to organisations tackling Ebola. Now, this brings new meaning to the term dead money. One of our partners, Street Child, is spending up to £100,000 per month on protecting orphans who have been orphaned because of the Ebola virus. At this rate of expenditure for a relatively small charity, which Street Child is, then you can imagine the sorts of expenditure that larger organisations and international bodies are going through. So with those figures in mind and those sums in mind, it would be appropriate to say a bit about what we at WICF have been doing. WICF is part of a trusted network of community-based organisations in Freetown. This consists of up to 20 organisations, and we decided to group 10 of these into an Ebola education programme. So 10 organisations, each contributed 2 people, 2 staff members, and we recruited a doctor from Connaught Hospital in Freetown to come and give all of our staff some training. So with the training, which was an intensive 2-day course, we then had 20 Ebola educators who went out into 19 different communities and reached over 10,000 people in the most hard-to-reach, rough slum communities. And these are slum communities that we're not just going into blind. Each and every one of the staff members that went in there knew people there, and they understood the communities and the people they were talking to. They knew how to engage in the different power structures in those communities, from speaking to the chief and the elders through to understanding which gangs operate in those areas and how to convey the message most effectively to make sure that each family they speak to can protect themselves against Ebola. And this was our goal. But not only that, we equipped them with monitoring and evaluation toolkits so that they're going through the communities and they're educating families household by household, hammering this message home, and they're testing whether or not those families have understood that message using an M&E toolkit. We'll soon be able to produce some really interesting data from this, and that will be available on our website and through our newsletter, which you can sign up to via our website, which is www.weyonechildfoundation.org. And I know that Developing World Connections will have access to this report as well. We did all this off a budget of $3,500 in 2.5 weeks. This shows the money power of small organisations. Now, to be fair, it's yet to show whether we had a strong impact. But all of the feedback that we've had, all of the tacit approval from community members, and the engagement of the 10 NGOs that we worked with, this all suggests that it was an effective programme, and we'll soon be able to prove that. As we look ahead beyond the current programme and what we'll be looking to do in the future, we will continue to do these education programmes. We just heard yesterday that the World Health Organization has announced that Ebola has reached its peak in Sierra Leone, yesterday being the 22nd of January. What this tells us is that we need to continue this message with more energy or at least the same energy than ever before. Now's the time to ensure that families understand that they need to continue to protect themselves and their communities against this virus, or it will come back, and we've seen how quickly it spreads. So we will continue to do that education program, and we need resources for that. Also, it's worth bearing in mind, and I don't know if it's WICF's role to be involved in this, but it's worth bearing in mind as interested participants in the international community that there is a famine around the corner for Sierra Leone. We had 2 failed harvests in 2014, and the result of this is that there's a chronic lack of food. Not only that, but the price of food has gone through the roof. So there will be a strong push to support families and communities like the 19 that we've just been educating to protect themselves during this period of famine off the back of the Ebola virus. There will also be a very big effort to rebuild people's lives, and in particular rebuild the broken education sector. That in particular is what WICF will be focusing on. We're going to go back to our communities, finish building these schools, make sure that we've got all the children and all the teachers fully trained up and ready to teach, make sure that the children have uniforms, stationery, the right curriculum in hand, to make sure that Crew Bay has a school on stilts so that it doesn't flood anymore, so that children don't have to sit in this community learning with water up to their ankles, that they're not thrown out of 3 different buildings like in the last year for not having their own space to learn. We're going to be continuing this effort, and so will the 20 other organisations that we work with in Freetown. So what we're hoping for is that you'll support us with this. On the one hand, we need help with the ongoing Ebola education program. This is something that you can get a live feed from through our Twitter feed, which is consistently updated. And we will also announce any updates in our newsletter and keep you well informed about the progress that we make. On the other hand, you can support our education programs. You can support the building of toilets. So I hope you'll support us. But I also hope that you'll stay in touch with us. And that's what we value the most, almost, is having an incredible network of supporters that we're incredibly to keep in touch with on a monthly basis, on a daily basis through our Twitter feed. Please join this community by signing up to our newsletter, which is, as I said, available through our website. Follow us on Twitter at WICF_SL. And keep in touch with us more generally. If you want to offer your skills, then you can write to me directly. If you want to offer your funding, then you can donate through our website. And if you want to just stay in touch, then that's easy to do as well.